Hi, everybody. How are you? This is my story, my life. Well, I got the news. Well, I should start from the beginning. Well, last year I was pregnant, had gestational diabetes. My daughter was born, my baby daughter was born August 29th, 2012. But 2 weeks before she was born, um, I had a little trip, a little partial fall in the new bathroom and basically kind of stumbled over the corner of the tub, missed my stomach, but um, did hit my breast. Um, during, well, after pregnancy, after being pregnant, after my daughter was born, I was having issues with breastfeeding. And then many of the doctors said, a few of the doctors said that it had to do with the glycobride medicine I was on, possible side effect, not producing enough milk to feed the baby. I was like sitting there for like 30 minutes at a time over a 6 week period of time, um, breastfeeding for 30 minutes only to get 2 ounces of milk each time, which is extremely low. Well, after 6 weeks, when my milk dried up, um, I realized that there was a lump. Then I was like, oh, maybe just a clogged milk duct or, just some minor bruising from when I fell in mid-August. Um, but then in February, I realized that that the lump actually rose to the surface of my left breast and it caused me some alarm or concern. So I said, let me go to the doctor. So I went actually to my general practitioner for a routine physical and told her I had a lump and I would like to get a mammogram. So went downstairs that day, got a mammogram of each of my breasts, left and right. The person said, since I'm already aware of a lump, I need to go actually to make an appointment. I need to have an appointment made as soon as possible at the center where they could do a mammogram of that specific breast and also a sonogram. So about 2 weeks later, I did that. Then saw the images of from the mammogram and the second mammogram of the left breast and sonogram, and then I was told, this doesn't look too good. Has calcifications, and there was a calcification through one duct. So I was recommended at that time to get a biopsy. I had a biopsy the Friday before Mother's Day, 2013. So that was May 10th. I had a biopsy. Then on May 13th, Monday, May 13th, the following Monday, the Monday after Mother's Day, I received the news that afternoon that I actually had a ductal breast cancer. So, I mean, it kind of was like, the only thing to do, I was just saying to myself, oh, I need to get this out. So, and different people, well, the breast nurse, health nurse called me to give me a whole rundown, of, I guess, things that I'll be going through, who to call, the surgeon, and make appointments and things of that nature. So that same week, that Wednesday, I actually went in to see my general surgeon, and then the general surgeon immediately set up an appointment for that same day, but later on in the afternoon to see the plastic surgeon. So Dr. Kralik at Kaiser Largo and Dr. Chang at Capitol Heights, Kaiser. So I met with them. They seem pretty good. They seem decent, even though at that time I didn't have a whole bunch of questions because I didn't have time. I didn't had opportunity to do any research for myself. I was just going to see, okay, what is this? What do I need to do? Pretty early on after that, I decided just to make the decision to get the double mastectomy. But in the meantime, after meeting the both surgeons, Dr. Garlic, the general surgeon, actually, just to double check on things, wanted me to also get an MRI to make sure that they know totally what's going on in the left breast and to make sure that the right breast was actually clear and nothing's going on there. But I still, just so I don't have to go through it again in life, I just opted to have the double mastectomy. I think that's the best thing to do, just get it out. And, in life, lower my chances, because who wants to go through this again? Like, I'm fine now, because I know the reality. I'd rather have an operation and make sure I'm fine from me, myself, my family, and friends, and then be dead, or something like that. So, that's my story for now. I'm scheduled to actually have my breast surgery on Monday, July 1st, 2013, with immediate, breast removal, 2 breast bilateral mastectomies or double mastectomies, and having immediate reconstruction at that time. So, I know it's a journey. I'm praying that I don't have to go through the radiation and the chemotherapy, because that I hear that, I see, I'm looking at other people's YouTube blogs or videos talking about their experiences, and it seems like each individual has there's some similarities, but depending on the length of treatments, and things of that nature, even down to the type of breast surgery you have. There's so many different options of types of breast surgery. If you're going to use your own skin and fat from your stomach, or do they have to basically stretch skin in another part of your body, back, thigh, leg, buttocks, to create a breast if you don't already have enough skin to do the reconstruction or to hold implants. There's a lot of stuff out there, but I'd rather just have straight implants, so at least with clothes I'll have some normalcy and things of that nature. But until then, I know it'll probably be, just recuperating from the surgery itself, getting breasts removed, that's major, so I just have to grin and bear it and get through that. Do I have to? The thing that kind of sucks about this is that, of course, I have by that time, a 10-month-old, and I'll miss definitely holding her, being able to hold her and hug her, because she's always on me, using my little breasts as leverage and things of that nature. But I probably feel funny not being able to hold her or, attend to her like I want to during that period of time when I'm recuperating. So, what else? And then, of course, this year, 2013, my sorority does a Sigma Theta right here at the nation's capital. I live in the DC metro area. We're having our 100-year centennial. And of course, I prepared. I registered for the Centennial Convention this summer, and July 11th through the 16th, I believe. But I was planning on attending the weekend activities from the Friday the 12th through Sunday the 14th. But I'll see how I feel and see. I already prepared for the gala, bought 2 gowns ahead of time, trying not to be last minute. possible gowns I could choose from. I have shoes, so I mean, I have my options. Prayerfully, I'll be okay to go because that is an experience, and I think that'll, even if I'm a little under the weather, I think that'll make me feel better. Until then, I guess after surgery, once they check my lymph nodes, I won't know if I have to undergo radiation and chemotherapy. I pray that I don't have to go through radiation and chemotherapy. A couple of my family members who've been through back breast cancer before said they didn't, but years ago said they didn't have to undergo radiation and chemotherapy. So just praying that I don't have to, but if I do, I'll weigh my options and do what I gotta do. Maybe look up some holistic, homeopathic options because I've been told or I've observed and viewed other women's survivors' stories, and a lot of times, depending on the length of your radiation treatments, chemotherapy treatments, and the different drugs that you have to take to counteract these treatments, the nausea medicine and this medicine and that to make you feel supposedly normal, or medicine to make you sleep, medicine to keep you, I mean, it's just so much in your body. It's like your whole body probably going to shock. But a lot of the women said once you have radiation and chemotherapy that the life that you knew of previously is definitely changed. I don't know if it's a different form of normalcy after chemotherapy, but a lot of women said that their quality of life definitely isn't the same once they've been through radiation. Well, definitely the chemotherapy. And if I don't have to get radiation, I didn't know you look like you've been toasted. Look like they put you in a toaster. But thank you to all of the women that were brave enough, courageous enough, and selfless to, humble enough to share their experiences on YouTube and help educate the rest of us out here going through breast cancer, being diagnosed. And my prayers go out to everyone in their recuperation. I'm praying for their families, for the strength, and continue on. And I really appreciate there being such a wealth of information out there for newly diagnosed women with breast cancer. There's a lot of opinions. A lot of people went through different things, but still, the information is out there. It helped me. A lot of the information and other women's experiences has really, 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 really helped me. So, I definitely wanted to show off my little wild hair. I took out some cornrows that I did about 3 weeks ago on myself, just trying to play in my hair. I actually ended up keeping those cornrows for about 3 weeks, trying to hold out, and now this is on my hair. So I just wanted to show that, just in case. I don't know if I had to have the chemotherapy, and I know hair grows back after chemo, but if I needed a big hair picture, natural hair picture, or a video of myself, just so I could say, ooh, I got a big hair, look at all my hair looking wild, but here it is. And hey, I don't know what the Lord has planned for my life, the lessons that I have to learn, and I hope for other things, being patient and just giving me this time to pray and be focused and be patient, knowing that I have the strength to definitely get through this. But all I can think for now is a part of life that I have to go through to make sure I'm alive, for my family. I don't feel scared. I feel anxious about the surgery coming up, and just the anxiousness about, oh, what will I have to do after the fact? What, you know, what kind of treatments am I going to do after the fact? I already know about a hormone, and it's questionable radiation, and it's questionable chemotherapy. So, hey, I don't know. I just pray that I don't have a lot of side effects, but I will choose research what I'm putting into my body. That's a definite. I don't want anybody just shoving anything on me. If I have to do whatever I have to do, I'm definitely going to research it first. So, this is, what's today? Oh, this is Friday, June 21st at 11:40 p.m. I'll probably do definitely another video next weekend, because that's the weekend right before I have my surgery on July 1st, Monday, July 1st. So, thank you. Thanks again.